Okay, so my name is Alice Rothchild. I'm on the steering committee of the Jewish Voice for Peace Health Advisory Council. And I want to welcome everyone. This is a webinar that we've had the largest sign up in our whole history. This is our 22nd Jewish Voice for Peace Health Advisory Council webinar. Clearly, there's an enormous amount of interest in our work and in this topic, given the genocide that's going on in Gaza. Today, we're going to be having a discussion with Drs. John Kahler and Dr. Thayer Ahmad, who have both recently been working in Gaza as physicians. And just for a little background, for those of you not familiar with this organization, we are one of the councils in Jewish Voice for Peace. And we do a number of things, but we do try to do webinars related to health and human rights approximately every 3 months. So the format of today's webinar is that the speakers are each going to speak for about 15 minutes each, and then we will have a Q&A. So if you have questions, please put them in the chat, and I will be monitoring the chat and trying to cull from it questions that people are asking, picking particularly relevant ones, or ones that a number of people have asked, and then we will have a conversation after that. As you can see, the webinar is being recorded, and we will be sharing it with everyone who's registered. I think we had 340 people registering, as well as putting it on our website and on social media. So I'm going to start out with introducing the two speakers. Dr. John Kahler is a physician and retired pediatrician and co-founder of Med Global. He taught at Cook County Hospital for 30 plus years, and he was both the regional medical officer as well as the chief medical officer for several large federally qualified health centers. In 2016, after a mission to Aleppo, Syria, he retired from clinical work to devote the remainder of his career to the humanitarian space. Dr. Thayer Ahmad is a board-certified emergency medicine physician at Advocate Christ Medical Center. He serves as the Assistant Program Director for the Emergency Medicine Residency Program at Advocate Christ and the Global Health Director for the Emergency Department at Advocate Christ. He is also an Assistant Clinical Professor at the University of Illinois and a board member of Med Global, which is a medical humanitarian NGO that works in Gaza. He has been to Gaza, Syria, Jordan, Turkey, Kenya, and Greece as part of projects that focus on strengthening local healthcare capacity. So, John, do you want to start?
Sure. Thank you so much, Alison. Thank you, and hello to some old friends I noticed on the sign-in sheet. My name is John Kahler. I'm a retired pediatrician, and I am one of the co-founders of Med Global. What I'd like to do for the initial presentation is to give you a little background with regards to Med Global's presence in Gaza, both before and since October 7th. I'll give you an update on what we did during our first deployment there in January, and then I'll bring you up to speed. I just got out a week ago, and during that time, I was lucky enough to be able to go north of Wadi Gaza into Gaza City, and I'll bring you up to speed on that. I'll turn it over then to Thayer, who was with me on the first deployment, and when he's come back, he's been a tireless advocate for the Palestinian rights, having now just come off of a 1-week time in both New York speaking to the UN, as well as in Washington, D.C., speaking to various politicians. So Med Global's had a presence in Gaza since 2018, 2019. We've had a ground team, a country-led team there, and we were based in Gaza City, and we would send deployments probably 3 times a year for 2 weeks. And those deployments would be both the delivery of primary care, of healthcare services, as well as delivery of medications and teaching capacities. We worked very closely with the Ministry of Health. All of our activities, as all activities work going in at that time, were cleared through COGAT, and we work completely with the Ministry of Health for delivery of their needs. Now, after October 7th, our ground team stayed active. They were among the last to evacuate Al-Shifa Hospital, which I won't go into too much because everyone on this call is well educated with regards to the issues. But Al-Shifa was under siege from 11:15 through 11:19, at which time it was invaded. People were arrested, and the remainder of the healthcare workers were permitted to leave if wanted. At the time of the initial siege, there were 1,500 patients, 1,500 healthcare workers, and over 15,000 internally displaced people in and around the hospital, having the false assumption that the hospital was deconflicted and they would be safe there. It turned out to be, at the minimum, only somewhat correct. So in the end of November, early December, our team moved to Rafah, at which time they immediately got back to work in Rafah. And this was day number 113 that we went in on January the 8th of this year. During their time in Rafah, they immediately got MedGlobal embedded into the World Health Organization health cluster activities. It just so happened in October, I was in Syria and our medical director was in Cairo. We were getting ready to go into Gaza after our deployment in Syria. That obviously fell apart on October 7th, but it just so happened that our medical director, Dr. Nahrin Ahmed, was able to stay in Cairo and help establish an Egyptian team that immediately embedded ourselves with the World Health Organization EMT program. And so we were able to very early get involved in the crisis response into Rafah. And that culminated with us going in on the first international deployment from Cairo into Rafah in January, on January 8th. When we were there, we did three things. One, and Tahir will speak to the hospital-based portion of this. I'm a pediatrician, and we were opening a primary healthcare center, and we opened that on the second day I was in Rafah. At the primary health center, we saw, on the first 2 weeks, we saw between 600 and 800 patients a day. We worked with both ministry physicians as well as volunteer physicians from the community. I worked as a pediatrician. My colleague, Dr. Salul, worked as an internist. But basically, we were there to open the health center and to bring supplies in and to support the country staff. While we were there, in addition to that, we established 7 to 10, depending on what was deconflicted at any one time, 7 to 10 medical access points, which in that parlance are basically small clinics in shelters. And the cumulative effect of that was we had access to probably another 20 to 30,000 individual patients who were sheltering in these things. And for purpose of this discussion, think of one of the shelters like a local public school. In that local public school, there would be 30 to 40 individuals per classroom. There'd be as many bathrooms as exist in a public, in a public school, and in the courtyards in the surrounding area, there'd be more thousands of patients. All aspects of safety in that region were predicated upon working with COGAT, working with the IDF. Every day they would be in our transit from our safe house to the hospital and to the clinic. Every day there would be the necessity of clearing your literally your time and your direction. And to that end, they're supposedly deconflicted during that time and direction. There was a curfew, soft curfew at 6 o'clock, hard curfew at 8, where all the international NGOs needed to be back into their guest house by that time. Rafah, for those who need some perspective, Rafah is a city founded in about 1400, very old, classic Mideast city. It, at the time, on October 6th, it had a concentration of about 7,000 people per square kilometer. On February 1st, it had a concentration of 56,000 per square kilometer. So that gives you some idea of the numbers. But to put it even in more perspective, Rafah's square size itself can be put inside the new Istanbul airport perimeter. So we'll now be thinking of about 1.2 million people inside of the perimeter of a large airport at a concentration of about 56,000 per square kilometer. You get some understanding about the nature of the congestion. When we first entered Gaza on the January trip, it was surreal to say the least. There was no electricity. We entered at night, so the only things you saw were the shadows of people moving around, as well as the only lights you saw were those flashlights and or cell phone lights and or small fires made to keep warm. There was no, when we talk about tents, these are not real tents. There are some real UN tents, but basically what you're talking about is a makeshift shelter put together by any tarp you can find and any other things that you can find to keep the wind out. We were there just as the second bakery in Rafah reopened. So every morning there would be a line of 500 to 700 people waiting in line to get an allotment of bread. No, not food, but bread itself. And the amazing thing to me about that was how well the civil order held to that. These lines held fairly well. There are always a couple of fools that act up in these things, but they held pretty well. Down the line, you would see kids at the water trucks with the jerry cans half the size of them, waiting for their daily allotment of water. This is the refugee march. Obviously, refugees learn to do two things. They learn to wait and they learn to walk and wait again. And this was a perfect example of that. Anybody who's been to Moria or any of those places have seen this over and over. We left after 2 weeks, having opened the primary health center. But the other thing that we did while we were there was that we were able to establish connections, since we are in the nutrition cluster, we're in the health cluster, we were able to establish connections with UNICEF and with the World Health Organization. And at that time, there was significant food insecurity, but there were no real signs yet of the pending problems with famine and malnutrition. Because we could predict that, we made an agreement with UNICEF to set up a screening program at these shelters. We had access to that many thousands of individuals at these shelters. And so we were able to set up a project with them to do screening. And in addition to that, again, in anticipation of what was coming, we made an agreement with the World Health Organization to build out what's called a nutrition stabilization center, where those children who had either had moderate acute malnutrition or severe acute malnutrition would be referred both for caloric resuscitation, and if there were complications, we had built out a 6-bed inpatient facility. We left to come back and do advocacy work, which we did. I planned on coming back fairly quickly, and in March of this year, I returned, this time to do two things. One was to open up the nutrition center, which was now remarkably, and again, these are all kudos to our ground team. Nothing I'm saying could have conceivably been done without our ground team. So we opened up the nutrition center, continued our screening activities. In addition to that, we had colleagues that went to Al-Shifa now, Al Nasser Hospital now in Khan Yunis had been completely destroyed, was no longer functional. And Al-Aqsa Hospital, a little bit to the north of that, was operational. And we had, we had 2 emergency room doctors, a surgeon and anesthesiologist deployed to Al Nasser Hospital to help support the country team. They did absolutely heroic work. stayed on the job literally for 2 weeks. We had an OB with us that went to the local hospital, Qatar hospital in Rafah itself to do deliveries. And so they were heroic. I was there to help set up, to open up the nutrition center. And we also began to roll out a community-based mental health program, very, very unique to what to what's happening there. And hopefully will be a model for programs to come. The thing that I was able to do while I was there this time that I wasn't able to do last time for obvious reasons, I was able to go north of Wadi Gaza into the Gaza governorate. We were asked by UNICEF to go with them in order to evaluate the possibility of setting up a similar nutrition resuscitation program at Kahler One Hospital in and around Gaza City. I was able to go north. This was in a UN convoy. There was a UNICEF person and me. We were only permitted by the IDF to spend 3 hours there. Took us 2 hours to get there along a road that in normal circumstances, when I was there in 21, I used to travel from there to work at Al Nasser Hospital. So I mean, it was a 25-minute ride. Took us over 2 hours to go there because every literal thing north of Wadi Gaza is destroyed. The roads are blowing up. There's absolutely no ability to travel at any speed whatsoever. Every building you see is either flattened or blown out. By the time we got into Nasser Hospital, I'm sorry, by the time we got into Kahler One Hospital itself, the hospital had been hit, but was open. The ambulatory department was open, and wasn't as congested as one might have expected until you realize that this is the area of the city that had been cleared during the initial assault. I was able to meet a hero of mine, Dr. Hassan, who single-handedly during the initial assault kept the pediatric services opened in Kahler One Hospital. A true hero, and he's been on the wall essentially since October 6th, and has continues to serve his community and continues to serve his people. He wrote a wonderful op-ed piece very early in the crisis that I will give Alice the connection to, the link to later on. Anyway, we were able to deliver just a minuscule amount of special formula to them, but you might as well thought we were delivering manna from heaven. They were so happy. There is literally, the food insecurity is at a level of 4 or 5. Every patient I saw in the hospital at that time was malnourished. There was a patient, a 7-year-old who had leukemia, who had received a bone marrow transplant, and which failed, but had been receiving ongoing chemotherapy. That was cut off, obviously, on October 6th, and this child died 2 days after I left. So my plan will be to go back in April, late April, to continue our work on a nutrition center, as well as to develop our work on the mental health program. So that's the report from north of Wadi Gaza and our current work in Gaza City. And I will certainly turn it over to Tahir to give us an update on what's been happening on the advocacy standpoint. Thank you so much.
Thank you.
Hello, everyone. Want to thank you for the opportunity to be here this afternoon on this seminar, or in this morning, depending on where you live. As John mentioned, I was able to head to the Gaza Strip in January. I had been to Gaza 4 previous times with Med Global. We had done different projects in a Shifa hospital. So I had a lot of people who I knew very well there. And when October 7th happened and the subsequent war broke out in Gaza, obviously many of us were watching from home, pretty horrified about what was taking place, and we're really kind of hoping that there would be an opportunity to be able to get on the ground. And I think, something that's important to mention is, nobody was really allowed access into the Gaza Strip, especially foreign medical delegations, until late December. And so me and John were a part of the second foreign medical delegation that was under the umbrella of the WHO's emergency medical teams to be able to enter into Gaza. There's a couple of things I want to mention, and I do have some slides that I'd like to share with everybody and kind of take you through my experience there. But part of the work that I was doing over the last week was really trying to highlight what's happened to the healthcare system and how it has collapsed, and how this has been a story that's been repeated over and over again in the Gaza Strip, where hospital by hospital, we are watching a dismantling take place, where a military starts to surround the hospital and its perimeter. Then it is under siege. It's cut off from the rest of the Gaza Strip. There can be no aid delivery, medicine delivery. Nobody can access the hospital, and nobody can leave the hospital. Then we're watching sort of a subsequent raid take place, where many of the healthcare staff are abducted. Many patients are abducted. Many people are killed in the process. And then the hospitals are rendered defunct. And this has taken place hospital by hospital. We've seen it start in the north and continue to head down towards the south. I think the most famous incident was in November at Shifa Hospital, where I had worked multiple times in the past and done different ultrasound trainings with the staff there. And I think it's important to keep in mind, Shifa is the center of healthcare in the Gaza Strip. It's the largest hospital, it has the largest capacity. All of your specialists are there. Many people go through the doors at Shifa Hospital. And so when you take Shifa out, you already put the healthcare system in a precarious situation. And this is not considering the bombs that are dropping, the tanks that are shelling, the ground troops that are invading. It's also, notwithstanding the medicine that is on the border in Egypt, unable to get in. We're talking about critical and essential medicines, everything from insulin to seizure medications to antihypertensives. And if we're doing that to one hospital like Shifa, you're already in a very, very difficult situation. If you start doing that to all of the hospitals, like what we're seeing unfold, you become essentially an area where people have no access to care and no place for them to seek out. And then the second thing I'll say before I start sharing my slides that's relevant to the first slide is, I think most people in the Gaza Strip had the false assumption that schools and hospitals would be a sanctuary, a safe haven. So at Shifa, we know that there were tens of thousands of people sheltering inside and around the hospital. And I was sent to Nasser Hospital in Khan Yunis, which is still southern Gaza, but it's not as south as Rafah. And Nasser Hospital was the second largest hospital in the Gaza Strip. And then it became the largest remaining hospital in the Gaza Strip after Shifa was rendered inoperable. And so it puts an additional burden on your entire healthcare system. But also, I think what is catastrophic and where we will see something called excess mortality is when you start to see that people are going to die unnecessarily because of the lack of access, or because of the healthcare system or hospital facilities are overburdened and overwhelmed, and they cannot accommodate the influx of patients that they're seeing. So I'll share my slide here and kind of take you through a few things. All right. And Alice, are we able to see my slides? Okay, great. Okay, so this is a Nasser hospital complex. This view is from the window of the room that I was staying in. So when we got deployed by the WHO, they sent us to Nasser Hospital. We were there every day, and we were sleeping at the hospital in the call rooms that were there. As you can see, the tents outside over here are some of the 10,000 people that were sheltering in and around Nasser Hospital in January. The view looking down, there is one of the 122 destroyed ambulances in the Gaza Strip since this has happened. And I will kind of touch on why that's such a devastating thing for the hospital complex, as you can, or for the hospital system, as you can imagine. This is the emergency department. This is at Nasser Hospital. We call this the resuscitation bay. It's where all of the trauma patients would be brought in, where we would essentially treat them. And because the hospital normally can house 350 patients at a time, and we were in the midst of 1,000 patients who were in Nasser Hospital being treated, we ran out of hospital carts. And the vast majority of people that I treated in the 3 weeks that I was there were people I treated on the floor. I want to point out to this orange device here. This is a ventilator machine, and it's an old ventilator machine. I struggled just figuring out how to work the thing, despite it being very old, finicky. It was what we had to rely on if we decided to put somebody on a ventilator. And then I also took a picture here of this oxygen tank on the side. And the reason I took a picture of it is because this tank's meter was broken. And it made it very difficult for us to place patients on oxygen. And I would say it made it dangerous, because we had to constantly check if this tank was running out of oxygen. And I distinctly remember one patient who came in, a trauma victim, who we had to, the tank had run out, and we realized a little later than we should have. And of course, his oxygen levels suffered as a result of that. He was hypoxic, and it was primarily because we didn't realize that this meter is out. And so already, despite the, without even mentioning how overwhelmed and the influx of trauma patients that were coming in, it's the job is already tough. The resources that we need are not there. And this is a place that when I showed up, it had been around 3 months where you're really the supplies and the resources that you get are not enough, but they also are intermittent. It's not consistent. We don't know. One day a truck might get through from Egypt into the Gaza Strip, and then that truck might be able to make it to Nasser Hospital and give us the morphine that we need for that day, or the anesthesia that we need. And there's some days where you're just at a critically short supply of the things that you need, or you're totally out of it. The other thing I'll mention is, while we were there in January, it was in the midst of an intense military campaign in Khan Yunis. Nasser Hospital is in Western Khan Yunis, and the military campaign had started in Eastern Khan Yunis. This is and I apologize. This is as graphic as it'll get, but just in case there's anybody that may have some sensitivities. But this is what I mean when I say we're treating patients on the floor. They are being brought in, sometimes by paramedics or first responders, but most of the time by their family. If it's an airstrike, the family will wrap them in a blanket from the house and rush them over to the hospital. If it's an ambulance, they'll bring them in, obviously, on one of these carts, and that's how we have to work on these patients. And sometimes they're brought in on the back of a donkey cart. And when you see a destroyed ambulance, it's obviously you lose your capabilities to be able to go rescue and retrieve the injured patients and bring them to get treatment. But also it becomes exceptionally dangerous for the already overworked healthcare staff, these first responders, to be able to access these patients. I do want to highlight something about the Palestinian healthcare workers that we got to work alongside. So yes, the situation is devastating, but I think the Palestinian healthcare workers are going to be the people who are not going to get the credit that they deserve. I wrote an op-ed in USA Today, I think about a week and a half ago, and I just wanted to highlight the incredible work that these people are doing. So we're in the hospital. The doctors and the nurses are working 24-hour shifts. So it's one day, 24-hour shift on, one day off, and then you come back the next day and you're working another 24-hour shift. They have been working around the clock and without pay. So there was a one-time $200 payment that the healthcare staff was paid back in November. And since then, nothing, not a single dollar, not a single shekel, nothing. And they are asked to do so while they themselves are displaced, while they themselves are dealing with food insecurity issues. Many of the doctors that I worked alongside and the nurses had their families sheltering in those tents that you saw outside of Nasser Hospital, or they had them sheltering in Rafah further south because they were too big of a family to be able to find the spot in Nasser Hospital. And they're doing some of these, they're coming to work every single day, serving their people. And they're doing so with this cloak of insecurity, of anxiety over their heads. They seen what has happened to the other hospitals. They also are hearing the bombing. While we were at Nasser Hospital, you could hear these bombs and you felt them. These bombs create this blast wave that just goes right through your chest. It closes your ears while you're trying to work. I mean, it's very, very intense. And every subsequent day, it's getting more west and west from where the Eastern military operations are taking place. Every day, it's getting closer to the hospital. And one thing that I'll also say is we were there during the longest telecommunications blackout. It was 8 straight days, no signal. So I couldn't speak to my family. But these physicians who are working 24-hour shifts, who know that their family is in very close proximity to the bombing that's taking place, could not check in on their family either. And their family could not check in on them. And so I found it, incredibly heroic what they were doing. I thought that it was superhuman. Like the fact that they were able to show up. I'm showing a picture of this doctor and this 4-day-old infant because these guys are absolutely not getting the credit that they deserve. And it's something that I try to highlight as much as I can. And John knows this too. He got to interact with so many of these people. And he talked about Dr. Hussam Abu Sufia, who refused to flee the north when the north essentially became no man's land, where people in the north were just left to die. This gentleman here is a pediatric surgeon. And here he's working on this 4-day-old infant who has this anatomical abnormality. He has this tracheoesophageal fistula, and it needs to be surgically repaired, and it needs to be done right away. It's not something that you can delay. It has to happen for this child to survive. He's operating on this 4-day-old infant without the anesthetics that he would like. There is anesthesia, but there's something called pediatric anesthesia that he's not able to use. He's doing so with adult tools. Some of the tools that he's using are larger than this child's head. And he has to do so, as you can imagine, in this very delicate 4-day-old. And he does so successfully, and he saves this kid's life. And he does so at Al-Aqsa Hospital in the middle area in Deir al-Balah. And then he has to go back after this 24-hour shift and go to the tent that he lives in. And I remember him sharing with us that his elderly mother was in one of these camps, and that part of the issue was that it would take her 15 minutes to get to the outhouse so that she can use the bathroom. And that was one of the things that we was thinking, how is he going to address this issue? How can he make conditions better? I mean, these are the people that we were dealing with. And this is the situation that they're putting themselves in. And this is what we were talking to the United Nations, especially members of the Security Council, as well as National Security Council, the State Department, the Department of Defense, senators and Congress. We're saying that at the very minimum, we cannot even guarantee the safety and security of healthcare staff, of patients who are injured, of internally displaced people. This is what they have to look at. This picture here is from the hospital. It's from a window in the hospital. You're seeing these massive explosions take place that are rattling the hospital. And it's getting closer and closer and closer. And then this is just an image of, this is the coastal road as you're heading south. There's no place in Gaza that's safe. There's bombing taking place everywhere. These are the people that are sheltering in the hospital. I know that there's a lot made of that, about who's inside of these hospitals. I mean, the hospital there is not an inch. There is not literally a place that you could turn without stepping on somebody. These are families sheltering there because they know that aid distribution will take place near these hospitals. If you look down here where there's these double orange doors or brown doors, I mean, these are people who are sleeping, right, and this is where the operating room is. And if you've ever been in an operating room, you know how, sort of secluded and isolated it is, because it needs to stay sterile, and it needs to have easy access when you have critically injured patients who need to get in there quickly. This is the outside of the hospital, people just hanging around, waiting to hear any news about if there was going to be a ceasefire, if there's a truce, if there's an aid distribution, what was the latest that was taking place in other parts of the Gaza Strip. And then this is kind of the flour that's distributed in the pediatric area. The families are there kind of collecting the flour and then baking the bread inside of the hospital. This is the wall that separates Egypt and Palestine, the Gaza Strip. This is called the Philadelphia Corridor. So you've got 3 separate walls. If you turned around from this spot here, this is what you see. Tents have literally gone up to the edge of the Gaza Strip, southern Gaza Strip in Rafah. It is tent city. And while we were there, hundreds and hundreds, if not 1,000 people per day were coming from other parts of Gaza to Rafah, looking for somewhere to shelter. And you see these people just hop on the back of these trucks. The other thing I want to mention is diesel fuel has not entered into the Gaza Strip. There's some that's entering through the black market, through Egyptian Border Patrol, that are selling it at insanely high prices. And, you know, one of our drivers was, when he would take us to hospital or a healthcare facility, he was telling us how expensive it was. I mean, just a full tank in a van is somewhere between $200 or $300, and so that was really expensive. But some of these people were resorted to using cooking oil to power their cars, which is very creative, but also devastating for the car, as you can imagine. That car is not going to last very long if you're using the cooking oil. And then this child up here with the bandage over his eye is one of the 8,000 medical evacuees in the Gaza Strip. He was one of the fortunate ones to exit. He exited on the day that I was able to leave. He was one of 8 people. And this is another primary concern that we were raising, saying, if we're not able to guarantee, if we're not able to have an immediate ceasefire, which is what we need, if we're not able to have the necessary aid enter into the Gaza Strip, and then that aid be able to be safely distributed, and if we're not able to protect the hospitals and protect the doctors and the nurses, then we need to have an avenue for people who are injured, at the very minimum, to get out of the Gaza Strip and get the treatment that they need. And there is a long list of countries that are ready to do so. But Israel and Egypt seemed, for whatever reason, that we can't really figure it out, to have made the process increasingly difficult, very bureaucratic, very arbitrary. And as a result of this, many of the people on this list of 8,000 who need to leave the Gaza Strip will die waiting. They'll die waiting to leave. This is just in Rafah. Obviously, you see the gas station wrapped around there. There's no fuel entering there. This is in the courtyard of Al-Aqsa Hospital in Deir al-Balah. Many of the children and the people there, they could recognize that we weren't, that we were not locals, that we had come from somewhere else, just asking us about the United States. I'll say that when we told them from Chicago, you can see that one of our general surgeons, Dr. Chandra Hassan, he's showing them on his iPhone a picture of some of the protests in downtown Chicago, and they were very, very stunned to just hear that people were chanting about them raising the Palestinian flag. It was something that blew their mind, and just something that in the midst of all of this that's taking place, it's something I wanted to mention, just to kind of sort of put a face to some of these people that are there. And then this is the coastal road along Rafah. And this is in Rafah, but this coastal road stretches from south to north. You can see many people are sort of posted up on the side here. We know that electricity has been an issue. Nobody has it, and the people are resorting to having to use some of these portable solar panels to be able to charge their phones. They're charging a car battery, and then that car battery is charging their phones. Here's what some of the aid distribution looks like, queues for miles and miles. It's something that we saw plenty of. This is an example of just people sort of on the street. Sometimes they'll take their aid, they'll sell it, they'll barter it for whatever items they need. Hygiene products were an issue, diapers were an issue, infant formula was an issue. And these are all things that kind of, our people are looking for, but they're also pretty expensive. Much more expensive and inflated, given that there's not a consistent supply that's entering into the Gaza Strip, and so that has its own effect. The donkeys are the main mode of transportation that many people are taking. They're pulling these carts, and like I said, they're used as ways to bring people, rescue them from the rubble, displace people, moving them further south. You just see families on the back of these with anything that they could grab. Here's an example, like some of these supplies that are sort of brought in or smuggled in. These bag of chips are 3 to 4 times the cost of what they normally would be, and the list goes on and on. And then this is just kind of on the beach on the Mediterranean Sea. There are 625,000 kids in the Gaza Strip who have not gone to school since October 7th. And among those are also medical school students and residents who are training. Everything has been totally interrupted. All parts of life have been disrupted. And, this is a picture of us just with the residents there who have been asked to continue to work, and even some of the medical students, just to kind of serve the people. And, they're just, they're curious about what their future is going to look like. Even the medical campus, the medical school campus has been obliterated, let alone, who knows how many people have been killed from the staff. If it'll ever be able to get up and running again, if they're going to need to leave the Gaza Strip to finish their training. This is in the pediatric ward of Nasser Hospital. You can see many women and children are sheltering there. Many people you'll see gather around the beach. They'll hold their phone up towards the sky, hoping to catch some signal, either from Egypt or Israel. This is again Dr. Chandra, some of the staff that were there. They're very hospitable people, and this is just around the hospital courtyard. People need to get haircuts. I mean, their lives have been totally disrupted. And I bring these pictures here because I want to share what my final days looked like at Nasser Hospital. That fighting, as I mentioned, got closer and closer, and the bombing became closer and closer until one of the evenings that we were there, the tanks surrounded the hospital. And the bombing was so intense that we took the mattresses that we had on our beds and we put them up against the window because we were convinced that we were going to become one of the many shrapnel patients whom we had been treating and seeing over the course of the 3 weeks that we were there. The hospital staff was very anxious because, as I mentioned, some of them were displaced from the north and had seen the hospitals that they had previously worked at, sort of get surrounded. And I remember naively and foolishly telling one of the ICU doctors, I said, I think Nasser is going to be fine. I don't think they're going to do anything to Nasser Hospital. And he said very quickly, why do you think that Nasser Hospital is any different than any other hospital in the Gaza Strip? Why would it be different than Kamal Adwan, than Al-Rantisi, than Al-Awda, than Al-Shifa, than Al-Aqsa, than Al-Amal? And he listed all of these hospitals one by one that had been surrounded and raided. And he predicted with really alarming accuracy what was going to take place. Ultimately, I was able to be evacuated from Nasser, but what they all feared took place. So the hospital was surrounded. I was able to get out of there. Then the hospital was cut off and under siege. Nobody was able to get there, even staff who were trying to get there. Then ultimately the water, the electricity, and the food was cut off. 6 patients in the ICU suffocated to death because their ventilator had no more power. The staff then watched Israeli soldiers raid the hospital, arrest 70 of the healthcare members, and then in the process, render it totally defunct, and it still has not gotten up and functioned to this day. And we heard 3 days ago that Shifa, as it was trying to resume services from November, it was able to have between 300 and 400 patients, and it was their ER had opened up again, and they had one surgeon, and as they were trying to get their services back up, we saw that it became surrounded and raided again, and now is defunct, and 200 to 300 people are still in the hospital, totally surrounded and under siege. I wanted to kind of end with that. What we're seeing on the healthcare system in the Gaza Strip is totally unprecedented. There's a notion, something called deconfliction, that needs to take place, and we need to be able to make sure that these hospitals can function, that they can serve the patient population, that they can get the medicine and the aid that they need, because when that becomes compromised, you will have an astronomical number of people who will die unnecessarily as a result of that. And there have, of course, as you all know, there has already been over 32,000. And I'll give you one tiny example. You cannot just move these people like cattle. They cannot just be herded from place to place, and you can expect things will be totally fine. We can't just say these are the safe areas. While I was at Nasser Hospital, they have a dialysis center there. Again, Nasser was the second largest hospital. So that can usually treat around 80 patients. They had 400 dialysis patients. Everybody in the Gaza Strip that needed dialysis, the majority of them will be there at Nasser. If anybody's familiar with what dialysis does, is when you have kidney failure, in order to remove the toxins, of course, you need to get dialysis, and you need to get it regularly and consistently. And most people get it 3 days a week, 4 hours at a time. When we were at Nasser Hospital, because of the large amount of people that were there, 400 of them, they had to decrease that from 3 days a week to 2 days a week, and from 4 hours at a time to 2 hours at a time. And I'm sure you're probably doing the math and thinking there's no way that these people can survive with their kidney failure for that long. And you're absolutely right. And I had to watch a 15-year-old who was not getting enough dialysis die at Nasser Hospital while I was there in January. The WHO has already told us that more people will die from things like this, from the fact that the healthcare system has collapsed, from disease spreading, and from the famine, than people who will die in the airstrikes and the tank shelling. And that, and I think every single doctor can bear witness to that, every single person that has worked on the ground. And so it's very important to us, at least, for there to be an immediate ceasefire. There has to be a ceasefire. I mean, if there can be no talk of a Rafah offensive, over 1.5 million people sheltering there, you are talking about a catastrophic bloodbath. And on top of that, the ceasefire is just the tip of the iceberg. We need to get these trucks with medicine, with food, with water, with tents, with blankets, with socks. They need to get into the Gaza Strip consistently and at a level that can accommodate what's taking place. 1,000 trucks per day is what's needed. And if the maximum is 238 trucks, if that's the maximum that we've gotten in the last 6 months, already we are putting these people in a very deadly situation where they're going to die a slow and painful and agonizing death. Starving from hunger is, what I've heard some Palestinians say is they really would rather be killed in an airstrike than have to sit there and watch themselves or their family members die from acute severe malnutrition and dehydration, from starving to death. And finally, if you get the aid in, it needs to get to the most vulnerable populations. We cannot watch 7 trucks of flour get into the north, desperately need these flour, watch over 100 hungry Palestinians try to bring back flour to their starving families, and they end up in body bags. Over 100 killed. And so this is what we've been talking to people about. This is what we're advocating for. And with that, and my daughter just entered the room, I'll stop there. And I appreciate everybody taking the time to listen.
Alice, can I
Thank
jump
you
in
so
for one?
much.
Alice, can I jump in for 1 second? This is John.
Sure.
I just wanted to make sure that I wanted to point out one thing that Taher had, some of the pictures he showed. All those pictures he showed along the Mediterranean and into Gaza that were there in January, there's not a square meter left anymore on any of those. So wherever you saw open space, beach, every one of those is jammed in with two or three tents. Second thing I want to say is we are at a tipping point right now with regards to nutrition. This has now been 6 months into it. Kids were getting about 80% of their caloric need before this crisis happened. Since then, now it's dropped to probably in the south, probably to 40 to 50%, but in the north, it's at about 20%. We're 6 months into this now, which means that kids are beginning to show severe muscle wasting, which means that their muscles are being utilized for amino acids. So at that point, the effects of malnutrition and infection will start to go up and be seen as deaths. Well, then when I was at the Ahmad and Dr, there were 2 babies that had died on the day I was there. 2 newborns actually at about a week of age had died, one for lack of antibiotics and the other because they were premature and couldn't have any breastfeeding. But the thing on top of that was above their cribs where they were in their little body wrappings, above the cribs was the neonatal intensive care monitor that had been shot by the IDF when it had come in. There were 2 bullets in the middle of the monitor. So let me just reinforce everything Taher said and really reinforce that we are at a tipping point vis-a-vis the nutritional status.
Thank you, thank you, thank you. This is obviously a devastating report. Several folks wanted you to comment on Israel's claim that Hamas is in the hospitals, and what's the story? Is there any evidence of anything in that regard? Could you speak to that? Because that's a common thing that people talk about.
Yeah, I mean, with respect to Nasser Hospital, because ultimately that was the claim. The claim was, there are whoever it is in the hospital. We didn't see anything of that sort. We saw the opposite. I mean, I just showed you the pictures of the families that are sheltering there, kids running around. It's for me, it's not something that I would have guessed in any sense of the word. It's not something I saw any evidence for. In fact, the WHO had sent us a message while we were there at hospital, and they said, FYI, this is what the Israelis have just tweeted out on Twitter or on X, whatever it's called. And it said, a rocket was fired from Nasser Hospital, Nasser Medical Complex. I was there. We heard every single gunshot, every single bomb that was dropped. We did not hear, see anything of that sort. And so I find it also very difficult to reconcile with the fact that there seems to be a systematic dismantling of each hospital. From north to south, every single healthcare institution has been surrounded. And the final thing I'll say is, the U.S. military in 2015 attacked a hospital in Afghanistan, Kunduz, where they killed a lot of people. This is Doctors Without Borders Hospital. And Doctors Without Borders came out and said, look, these hospitals need to be protected. There's all of these different things that suggest it needs to be protected. We share our coordinates with everybody. And even if there are injured people who, are wanted or for whatever reason, there still needs to be an ability for a hospital to function. You take out the hospital, you attack a hospital, you're essentially committing the local people there to death.
And let me jump in here too, because when they talk about deconfliction, this is why there's so many people so close. They deconflict at about a block. And so most hospital
Can you
complexes
define
have
deconflict? That's like
Sure,
a term that
deconfliction is giving the coordinates, safe coordinate. Deconfliction is essentially safety for the coordinates that are given. Now, so the hospital, they'll mark out the hospital coordinates and literally will be 1 block away that are not deconflicted. So if there was a rocket fired or some version of that, there's absolutely no ability to say where that thing came from. And the war zone or the fighting zone is within a block of the hospital. So these are specious at the best.
So a number of people are concerned about what happens to the staff that get arrested. I know they often get stripped and interrogated and taken away. Do you have any follow-up on that?
Yeah, well, the first thing I'll say is, I spoke to several physicians who had been abducted, one of whom was at Al-Aqsa Hospital. So I'll tell you kind of first what happens. Oftentimes what you'll see is they'll kind of get detained, they'll get abducted. They are taken to a facility or an area. They're not sure where. They are stripped naked. This particular physician who was in the ICU said that he was left to sleep outside naked for 2 days, one of the days that it was raining. This is all happening given the elements. Then they're transferred to another facility where an interrogation may take place. There's some abuse that will happen. Then they will be left alone for an undisclosed period of time. They're not given any sort of information. They're not charged with anything. Sometimes they're interrogated multiple times. Sometimes they're tortured. And then if you're released, you're sort of just released at Karam Shalom crossing and left to kind of find your way back. We also know that there are plenty of healthcare workers, 200 at this point, whose whereabouts are unknown, who are uncharged, who we just know have not returned to their families. Among them is an ICU doctor at Nasser Hospital. His name is Dr. Mahmoud. There's also the director of surgery, Dr. Nahed. And again, the doctor told us these questions mostly surround, who do they know? What have they seen? And there's a lot of questions to them about who they've been treating. And so we know that it's actually like a pretty traumatic experience. And it's also something that concerns all of us in the humanitarian NGO space, because if we continue to traumatize this healthcare staff that keeps shrinking because they're either killed or abducted, how can we ask them to go back to work and serve the population, right? They are going to have their own needs. And so, it's a big concern.
And I've heard that current estimates are, even if the fighting stopped or decreased, that there would be more deaths from infectious disease than injury. Can you speak to that particular theory?
Yeah, there's no question about that. There is simply the issue of uncontrolled chronic diseases, which is blood pressure, heart medicine, diabetes. It's estimated to be 950 children with type 1 diabetes, insulin-dependent diabetes, and no insulin. So those kids will end up suffering. And the newborns I just mentioned, women who have been deprived of nutrition during their pregnancy and stuff, the increase in newborns have gone up, the increase in stillborns have gone up. None of those will be considered war deaths, and those are certainly going to go up, in addition to the tipping point I mentioned earlier about malnutrition.
Yeah.
No
and
question.
the John Hopkins, the School of Public Health, as well as the London School of Tropical Medicine and Hygiene released a report where they were trying to use these predictive models looking at just that. How many people will die if there is a ceasefire today? There's a cessation of hostilities. How many people will die if this continues? How many people will die if there is an invasion into Rafah? And they're looking at this and they're kind of trying to understand what about some of the infectious disease that's spreading through the camps, like hepatitis A. They're also looking at the chronic diseases that John are talking about. The numbers are insane. I mean, even if everything stops right now and everything gets in and we start working on recovery, there will be an additional 6,000 to 7,000 people that will die. And so you can imagine what those numbers will look like if hostilities continue or if there's a ground invasion.
Yeah, and they had said that if there's an epidemic and the hostilities continue, it's like 85,000 people in 6
Absolutely, yeah,
months. It's just
exactly.
terrific. Okay, there's a question about the potential role for clinicians of various specialties and expertise to join you on future missions to Gaza with Med Global.
Yeah, and I see somebody who put sort of I see it's Dr. Hassan, the general surgeon who came with us. Yeah, there is the email there that you see that you can email if for your interest. Of course, the needs will have to match kind of what the situation on the ground is, which is changing every week. We're trying to continue to send people as much as possible into Gaza, and so we want to be able to address whatever the needs are. But this is it becomes very, very tricky, as you can imagine, if there is some sort of ground invasion into Rafah.
Plus, the other issue becomes, I was asked by the American Academy of Pediatrics around a disability issue, and I certainly invited them to come in. It'll be tricky, but it's very important for any policymaker from a subspecialty organization to put their feet on the ground. If they don't do that, then this is just some big dialectic that they can talk about. They won't know it until they actually. I was prepared. I've been in a lot of bad places in my life. I thought I was prepared. It was an order of magnitude worse, and in March was an order of magnitude from January worse. So they need to put their ass on the ground to see what's happening.
And in the United States, we have, all these attempts to defund UNRWA. We have the AMA, which is just not making any progress here, as well as other professional organizations. The only professional organization that's come out for ceasefire is the American Public Health Association. Can you speak to stuff in the US and what we should be doing and how to push the medical profession as well as Congress?
Yeah, absolutely. I'm so happy you mentioned that. I think that's part of what the issue is. We need to have, I guess these professional societies be able to recognize and highlight the humanitarian crisis. And when you have the AMA take a very different approach than they did with the Ukraine, it makes it really, they're trying to get at sort of the legitimacy of these calls. I mean, the international humanitarian community is in total consensus here, right? This is the worst humanitarian crisis since World War II. We need people to come out and speak out. We need more of a push for a ceasefire. We need aid to be able to enter. We know that airdrops are not sufficient enough. They're not efficient enough. They can be dangerous. We know that a maritime corridor will take at the minimum 60 days. You have multiple land crossings and we need to get these trucks in. So I would encourage people to tell their elected officials that we need to use these levers to be able to, of pressure to be able to get some of this aid in, to call for a ceasefire, to help with medical evacuations. Senator Merkley from Oregon, he was able to evacuate 2 children out of the Gaza Strip, get OHSU in Portland to support the care and their recovery and rehabilitation. That's a drop in the ocean. It's not going to make an impact on the floor, but it's going to highlight the situation on the ground. It's going to make, I think, a difference with respect to people understanding that there are a lot of vulnerable people there. And so these are some of the things that I would encourage people to mention to their professional societies. It doesn't just have to be a healthcare institution, by the way. I mean, we saw many unions come out for this, many teachers unions. I mean, all of civil society can contribute.
So the other thing also is that, remember what Tyra mentioned, and it's absolutely correct, which is that the bombing can stop tomorrow and the educational infrastructure is destroyed. And that means the educational infrastructure for healthcare professionals also. So one of the things that people can begin to think about is how to incorporate bringing some of these students who've had their education cut off at 2 years, cut off at 3 years, bring them into Europe, into the United States, to help finish up their education with whatever caveats they need vis-a-vis going back when it's done. But it's extremely important to understand that you can rebuild a hospital with enough supplies, but agency and education is something that's going to be ongoing. long after the bombs have stopped dropping.
And also, we should speak to the whole psychosocial mental health aspects to this. That's been touched upon, but not a whole lot, because not only is there a huge need for food and water, but there's this massive amount of psychological torture and, chronic stress disorder and trauma. And can you speak to that?
Sure, I can. We're just set up the beginnings of a community-based, community-run mental health program, working out of the shelters and out of our primary healthcare clinic in Rafah. I would add to that 100% of the population is affected. It's absolutely impossible to not be affected by the chaos that's going on. And we talk a lot, in this space, we talk a lot about taking care of our workers. Usually we mean physically taking care of our workers, but we also have to understand that it's our workers who are within that 100% population. So in that community-run mental health support, we're concentrating on our workers in addition to the populations in the shelters. The other thing is there is traditional, and that's a community-based model. The other thing is there is traditional needs for anxiety medication, seizure medication. There are schizophrenics that exist. All of that exists, and we're trying to raise funds to bring those same supplies are queued up at the border and need to come in. There were 2 psychiatrists, by the way, before all of this crisis. There were 2 psychiatrists in Gaza. One is now dead. So you can figure out what those needs are.
And then I would just mention about UNRWA being defunded. We know that the bill has passed with respect that, for the budget, and that includes defunding UNRWA, has the language in there. Of course, this is a major concern. I know that there are several people who are working on trying to find some sort of amendment or something that can get funding resuming. That's another area that I think we should be pushing for, because of course, UNRWA operates 165 shelters, is one of the main aid distribution NGOs on the ground. They're from the people, 13,000 employees. They know the most vulnerable populations. They also function essentially as this quasi-government with their education and their educational facilities there, water and sanitation. And then, I would point to what Save the Children also published about the psychosocial needs prior to the war. So this is, many children, if you're 18 years old, you've seen 4 previous conflicts prior to this one. And they had already mentioned that, 2 in 5 kids in the Gaza Strip had suicidal ideation at one point or the other, and that there was a significant portion of them who were self-harming. I can't imagine what this is going to look like after this war.
And just since we're over time, looking at the big picture of justice and the issue of war crimes and the issue of what's going on at the International Court of Justice, can you speak to the higher level of this in terms of international humanitarian law and how we can move that forward as well?
Yeah, I mean, of course, I'm not a lawyer, but everything that I thought with respect to how things would need to take place in a conflict setting seems to have not applied over the last 6 months. I can specifically talk about, the hospital system itself and sort of how that, I think there was a critical moment in November with Shifa. And I think that sort of that led the way with respect to, these vulnerable populations kind of being subjected to an incredible amount of violence, and healthcare workers, the lack of access for journalists also being killed. All of the civilian infrastructure in the Gaza Strip has been devastated. And so, I think when it comes to international humanitarian law, again, not speaking from a lawyer position, it seems like it's held zero value here with this conflict. I mean, this is totally different than anything that we've seen. And I'm just, I'm not very optimistic with respect to these channels sort of bringing about any sort of change or impact.
And I'd also add on, you mentioned it, the whole issue, there's no ability to have press inside of Gaza, independent press. We've had folks from the Washington Post Bureau try to help them get in. So the ability to have any legitimate reporting is virtually zero.
So thank you. I think we're going to wrap up now because we're over the hour. Just so folks know, this has been recorded. The recording will be available on our website, jvphealth.org, as well as sent out to anyone who's registered and on our email list and on social media. So please share widely. And I would encourage people to use this information for political activism and to pressure public elected officials, and also to pressure your professional organizations if you're in the healthcare profession. I want to also let people know that we do have, JVP Health does have a weekly health and human rights update on the health and human rights conditions in Gaza that comes out Sunday night, Monday, depending on my life. And we curate all sorts of information on that. And we also do a lot of other advocacy and writing. With all of this interest in the health and human rights issues in Palestine, we are also working on setting up working groups that can make our messaging and our social activism and political activism more effective, and our advocacy. So please go to our website, sign up, because we'd love to have you on our working groups. So I want to thank everyone, and I want to thank our wonderful speakers. This has been a very informative and powerful and distressing and disturbing webinar. So thank you, thank you, thank you. Take care.